Welcome, everyone. My name is Diana Carr, and you are here for the Women's Fitness Through the Ages, Nurturing Wellbeing Across a Lifetime webinar. Thank you so much for joining me tonight. Feel free to ask questions. I want this to be interactive. There's also the chat, so you can use that function if you don't want to, maybe you have a question, but you don't want to interrupt while I'm talking. Feel free to put questions in the chat. So let's go ahead and get started. So for those of you who don't know me that well, again, my name is Diana Carr. A little bit about me. I am a wife to my husband, Nick, for 15 years. I am the mother of two children, a almost 10-year-old and a 7-year-old. And I am a data privacy officer turned health enthusiast. So my current profession is I'm a certified health and nutrition coach and personal trainer. I specialize in working with women to empower them to invest in their health. I founded my company, Be Well Health Coaching, back in June of 2021. My journey into health coaching stems from some personal health issues where I, fell in love with nutrition and decided to kind of take not only control of my health, but control of my career as well. I currently live in Springfield, Virginia, and I like to run, strength train, cook, read, and glamp with my family, which is just another word for fancy camping, not roughing it camping. So what are we going to talk about tonight? First, we're going to just go over an overview of women's fitness, why it's important. Then we're going to talk about special considerations at each stage of life, walking us through childhood through postmenopause. So covering the full gamut of a woman's life cycle. And then we'll just wrap with some summary and some next steps. So I'm sure most people on this call understand that exercise is important. There are so many benefits when it comes to exercise, both physical and mental. Some of the physical ones are obvious. Our cardiovascular health, it increases our muscle mass, it improves our flexibility and balance, it strengthens our bones. But some physical benefits are maybe a little less obvious. It improves your digestion. It helps regulate your blood sugar. It helps us manage weight, and it even helps us sleep better. And so those are just the physical benefits. Now, there's a number of mental benefits to exercise as well. It helps boost our confidence and self-esteem. It improves our body image, the way we view ourselves. It lifts our mood, gives us more energy, helps us encourage independence, and helps us better manage stress. So a lot of really great benefits from exercise. And there's a number of differences between men and women. Although the basic physiology is the same, right? We all have one head, two arms, two legs. But there's a lot of differences when it comes between the two genders. And while men are wonderful and we love them, they're not who we're talking about tonight. We're focused on women because, quite frankly, our bodies are much more complex and we go through a lot of various changes in each lifestyle that have specific considerations. And so that's going to be the focus of our presentation tonight. So let's talk just a little bit about the differences. So first, when it comes to hormones, estrogen versus testosterone. So the production and circulation of these sex hormones have a strong influence and function over many body systems, including muscle mass, fat distribution, bone mineral density, nutrient metabolism, risk for chronic diseases, etc. And both sexes produce both hormones, just in very different ratios. So men produce 10 to 15 times more testosterone than women. And this increase is primarily responsible for the development of male secondary sexual characteristics, such as facial and body hair and greater muscle mass. For both genders, testosterone plays a big role in the growth and repair of tissue, and it also declines with age. When we look at estrogen, which is primarily thought of as the female sex hormone, women have much higher levels, though men do produce a small amount of estrogen. And we are going to dive and talk about estrogen a lot more as we go further along, because it really plays a really big impact especially in like perimenopause and menopause time. When we look at basic skeletal structure, Women differ from men in that we have smaller bones and lower centers of gravity, and we also have different joint angles that alter movement patterns. When it comes to amounts of muscle and lean body mass, on average, men have larger amounts of lean body mass compared to women, which is why, generally speaking, they tend to be stronger, have greater aerobic capacity, and lose greater amounts of fat faster, which can be really frustrating if you have a spouse or just a male friend or sibling that tends to lose weight quicker than you. And this is because the amount of muscle and size is directly correlated to your resting metabolic rate. So if you're not familiar with what that term means, your resting metabolic rate is the amount of calories your body burns at rest. It makes up about 70% of your metabolism, and it is largely driven by your body size, and it is heavily influenced by how much muscle you have. So again, generally speaking, men tend to have larger sizes and more muscle, and so they have higher metabolisms, which can generally lead to burning more calories, losing weight faster. Our percentage of body fat and our fat distribution is also very different. So if you look at the pictures on the screen, you've probably heard of apple-shaped versus pear-shaped. And again, generally speaking, men tend to fall into that apple-shaped category, whereas women tend to hold more weight in their hips and thighs and fall more into that pear shape. Why our fat is distributed in that certain way is because we typically have higher percentages of body fat, primarily to fuel and support reproduction. Breaking it down, so the apple shape is primarily due to visceral fat, and what that is the fat tissue that sits between your organs and your abdomen. And this is actually much riskier. It puts more pressure on your heart. It leads to more metabolic diseases, but it's actually easier to lose. So that is the downside and the upside. When you're looking at the pear shape, this is more subcutaneous fat that deposits fat around your butt, hips, and thighs. And while this is less risky from a cardiovascular standpoint, it often can be harder to lose. And that's largely hormonally driven, again, because our bodies are built for reproduction. And so we carry more weight in these areas. Another difference between men and women is the shape of our pelvis. So most noticeably, the difference is that women's pelvises are proportionately wider to allow for childbirth. But an interesting note is that the wider hips influence the angle of the femurs, which is commonly called the quadriceps angle or the Q angle. And while this is of note or important, is that women actually are 2 to 8 times more likely to suffer ACL tears than men. And even though it's not proven that it's specifically because of the Q angle, there is thoughts that the Q angle does have an influence on this and does actually make it possibility that girls are, more likely to have knee injuries due to this increased angle, which I found very interesting. Another difference is bone mineral density. So, research shows that overall women have lower bone mineral density compared to men, as well as we lose it more quickly or more, per decade. Men also, because they're typically larger, they tend to have a greater aerobic capacity. And then finally, when we're looking at our hearts, so women typically have lower cardiac output and stroke volume. So stroke volume is the amount of blood that's pumped every time your heart beats. And then cardiac output is the amount of blood in liters per minute that circulates through your body. And the reason why our cardiac output is lower is that women tend to have smaller hearts than men, smaller ventricles, which leads to lower stroke volume. We also have less hemoglobin found per liter of blood, so there's less oxygen carrying capacity. So again, just some differences to better understand These are some obvious ways we know that we're different than men, but this just gives you a little bit more specifics as to really all the various differences. So one question I get all the time is, what should my fitness look like? What is the perfect exercise routine? What should I do? And the answer is, there is no one size fits all approach for everyone. And everyone on this call tonight might have a different fitness routine that works best for them, and that's okay. A lot of it depends on your fitness level and ability, your exercise history, your skill level, the stage of life you're in, your preferences, past injuries, etc. So there's a lot that goes into what would be the right exercise routine for you. But there is some advice I can give you that kind of works across the board. And the first thing is, consistency is key. And if you've ever worked with me, you've probably heard me say that many, many times. And it is important when it comes to exercise. It's important to keep showing up. That's how you form habits. That's how you make progress. The other thing is, some exercise is better than no exercise. And a lot of times I tell my clients, you have to get rid of this all or nothing mentality when it comes to exercise, because it's just not going to help you. Maybe you don't have 60 minutes to dedicate towards exercise, but can you carve out 5 or 10? Because 5 is better than 0 and 10 is better than 5, and so on and so on. And so it's important to recognize that any bout of exercise is going to be better than no exercise. Next, it's important to find things that you really enjoy, because I don't care how motivated you are or how much strong will you have. If you're not enjoying what you're doing, you're going to have a very hard time showing up every day. And so finding things that you find fun, that can be social, that you can do with a friend or a significant other, I think is really important. And then finally, variety is key. So it's not a great idea to do the same thing every day, for a couple of reasons. One, it gets boring. Two, your body will get used to it over time, and it actually is less beneficial for you. So you'll burn less calories, you'll get less benefit if you just do the same thing every day. And on top of that, you run the risk of injury or overuse if you're always kind of just doing the same thing. So, for me personally, I like to focus on 3 days of cardio, and that's a mixture of running, cycling, walking, and then 3 days of strength training, which is where I also work on my balance and stability. And I vary between weight training, body weight training, circuits. And then finally, I try to stretch before and after, any type of exercise I'm doing. So I'm just going to take a quick pause and just see if anyone has any questions before we kind of dive into the specifics of each kind of stage of life. So feel free, you can unmute if you have a question, or you can type it in the chat. Otherwise, we're going to keep rolling, and we're going to start with the considerations for childhood girls. So the good news when it comes to children is that the recommendations don't largely differ between boys and girls. So if you are a mom or a grandma of boys, that's okay. These recommendations apply across the board. So for children, it's really, the recommendation is 60 minutes of daily physical activity to really support lifelong health. And it's broken down into 3 categories: aerobic, muscle strengthening, and bone strengthening. And most of that 60 minutes should be made up of aerobic activity. Think walking, running, really anything that gets their heart rate up, dancing, swimming, riding a bicycle, with at least 3 days to include more vigorous intensity activities. And then children should also be doing muscle strengthening, which are activities like climbing, push-ups, playing sports like gymnastics or football, martial arts, at least 3 days a week. And then doing activities like jumping and running to help strengthen their bones at least 3 days a week as well. The biggest thing with kids is to be creative and make it fun. So, using games or fun equipment like balls, cones, hula hoops, bubbles, doing activities like relay races, a game of tag, agility game or obstacle course, playing on a playground are all really great examples. and encourage variety, which is important. So just like I said with adults, you don't want to do the same thing every day. It's also important for kids as well that you vary the intensity and the types of exercise across the week to help them develop the skills as well as their muscles and bones. Organized sports can be really important for kids because not only does it give them physical activity, but it helps them learn teamwork and sportsmanship. It also can be really fun and social as well. And family bonding is important when it comes to exercise. So finding things you can do as a family, walking to school if you can, making your leisure time active time by, going roller skating or playing catch, going on a hike, having a dance party, doing things as a family not only shows your kids that you prioritize exercise, but it shows them that it's important for them to do it as well, and really helps them with that lifelong healthy habit creation. Starting young, making it fun, involving the whole family will likely help foster this desire and this interest in being active throughout their life. So when we move on and talk a little bit about adolescence, this is where we start to see more specific changes develop between boys and girls. And the physical activity recommendations for adolescents are largely the same as children, 60 minutes a day, focused on aerobic, muscle, and bone strengthening. And when we talk about adolescent girls, we're really talking about the time from puberty to adulthood. And it's marked by a number of not only physiological, but emotional and cognitive changes as well. The exact age and phase depends on a lot of factors. Generally, girls start through puberty somewhere between the age of 9 and 14, and ends around 15 or 16, but can be even upwards close to 20. And these phases are marked by significant hormone fluctuations, which can impact, self-esteem, confidence, things like that. So one thing that tends to arise or can arise during puberty are body image challenges due to those like drastic physical changes. And according to the Center for Disease Control and Prevention, over 20% of 12 to 19-year-old girls are overweight and obese, with nearly 1 in 5 adolescents living with prediabetes. And so obviously it can start to become a concern at this age. And then on the flip side, there's also a startling trend that girls have body image issues. Nearly 80% are worried about becoming overweight, which is a pretty stark number. And so, it's really important at this age to be mindful of how the adolescent in your life is talking about their body, how they are, reflecting, thinking about themselves. It's also really important how they hear you talking about your body. So that's something to kind of keep in mind. And when we're talking about exercise, especially with influential teens, we want to be focused on not just the physical looks aspect of exercise, so like weight, but we want to focus on, making us stronger, keeping us healthy, making our heart strong, our bones strong, helping us be flexible, the fun and enjoyment out of playing sports, things like that, those types of benefits versus just strictly like, body image type benefits. This stage is also a very unique opportunity to develop healthy habits, including regular exercise, which is very effective in boosting confidence, as well as improving anxiety and depression. It's proven that exercise habits in adolescence can impact physical activity in adulthood, so it's important to make it safe and fun, so that they're interested in doing it. Previously, it was thought that adolescents should avoid strength training because of damage to their growth plates, but now it's actually thought that it's an ideal time to introduce proper training as long as there's, appropriate supervision, and it will help them with strength and balance. So puberty marks this time where significant differences between boys and girls starts to happen. Because of the secretion of estrogen, then the woman's skeleton takes on more characteristics of adults. So you'll notice the pelvis starts to widen. There's an increase in bone mineral density. That Q angle that I talked about becomes more pronounced during this time. And so it's important to be teaching, proper form and movement patterns. Um, Achieving peak bone mass is really important. So not sure if you are aware of this, but you achieve peak bone mass by like age 30. And so after that, you're really just trying to slow down bone loss. And so the much that we can eat properly and exercise younger in life helps us to achieve a higher peak bone mass. And so this adolescence phase is really important for exercise, like weight bearing activities, emphasizing building strength, reducing periods of being sedentary, to help with like maximizing. You want to start off with as strong as bone as possible, so that as you lose bone density later in life, it becomes less problematic. And so it's important to, be active in that adolescent time frame because of that. Another consideration is aerobic capacity. So typically adolescents will have a lower aerobic capacity than adults because they're smaller. But as children start to mature into adolescence and their cardiovascular system matures and their thermoregulation improves, so letting heat dissipate through sweat, that helps. But still, compared to adults, adolescents' stroke volume is lower because their hearts are smaller. Even though their heart rates are higher, they still have a lower cardiac output. So it's just being mindful of that. Certainly adolescents can start doing more endurance type activities, but it's just mindful to know not to push them too hard, that they're not going to have the same type of capacity as we would as an adult. Some endocrine considerations is, as girls start to begin like menstruation, that their cycles will be a little all over the place. And so whereas an approximate, average cycle is every 28 days, it can certainly be shorter or longer, and it wouldn't be out of the ordinary for teens to be maybe even as long as 45 days. But something to be mindful of, I don't know if anyone has heard of the term female athlete triad. But if you have a adolescent in your life, this is something to be mindful or at least aware of. So the female athlete triad is identified by three things. The first is menstrual dysfunction. So say you had a teen who had started her menstruation, but then all of a sudden it stopped. Low energy availability. So this could be, not having, losing weight, not having enough calories. So either through overtraining or under eating, either through restriction or eating and purging. And then decreased bone mineral density. So an increase like fractures. So if you happen to have a teen or know of a teen who was going through this, where they were, all of a sudden no longer having their period, losing a significant amount of weight, then, one thing to watch out for would be like an increased risk of fractures. And this can be a dangerous cycle that women athletes fall into at a young age, if they're, overtraining and just not, nourishing themselves properly. So something to kind of be mindful of. So transitioning now to adults. So we're going to cover general recommendations for adult women, and then I'm going to go into the specific categories, such as pregnancy and postpartum, menopause and postmenopause. But we'll talk just generally about adult women. So think anyone who is ages, 16 to 18 through say about mid 40s, who's not falling into that pregnancy postpartum group. So general recommendations, according to the physical activity guidelines for Americans, it is recommended that healthy adults should do at least 150 minutes to 300 minutes a week of moderate intensity, or 75 minutes to 150 minutes of vigorous intensity aerobic physical activity, or some combination of the two, with additional health benefits being gained if you go beyond these recommendations. And in addition, adults should also do muscle strengthening activities of moderate or greater intensity that involve all major muscle groups on 2 or more days a week. So basically, what's it saying is as a baseline, the recommendation is to get at least 30 minutes of moderate intensity cardio 5 times a week with 2 days of full body strength training. So if you aren't meeting those requirements right now, that's okay. And we can certainly talk about strategies to help you get up to that point. But just wanted to kind of lay out like what the general recommendations are for health. I get the question a lot as to what constitute moderate over vigorous. So think if you were rating it on a scale from like 1 to 10, moderate intensity would mean you're somewhere around like a 5 or 6, whereas vigorous intensity would be more like a 7 or 8. You also could use the talk test. So think that moderate intensity would mean you could talk to someone, but maybe not be able to sing. Whereas vigorous intensity would be you couldn't say more than a few words without pausing for breath. So if you're kind of trying to think about like, how do I exercise? What is that? What am I doing? That can kind of help guide you as to know, are you falling in the moderate intensity or vigorous intensity bucket? We talked a lot about benefits in the first couple of slides. Improving cardiovascular health, increasing muscle tone, all these great things. Other things to be mindful of in this, adult stage of life is it helps you manage stress. Exercise is also a good form of self-care. So, finding things to do that are just for you throughout the day, exercise, I think, falls into that bucket and is a really good form of self-care. And so thinking about that is just another benefit of exercise. There's also a number of challenges, right? Competing priorities is probably the biggest one. I hear this a lot. It's like, I don't have the time to exercise. In this stage of life, you're often focused on your career, your family, or probably both. And with so many competing priorities, exercise is usually one of the first things to slip. And then as you progress through your 20s to 30s to 40s, it can seem like you have less and less time. What is interesting is that I probably exercise more now than I have in my entire life. Definitely more than I did in my 20s. And I reflect on that, and sometimes it makes me a little annoyed with myself as to what did I do with all that time before I had kids and tried to run a business. But now I'm just much wiser and understand the benefits of exercise. And so I make it more of a priority, which is really what it comes down to. We all have the same 24 hours in a day, right? So when people say, I don't have the time, we all have the same amount of time. It's just what do we value? What do we prioritize? And so that is definitely a challenge with exercise. It is finding the time, fitting it into your lifestyle. And we'll talk about some strategies for that. Then there's also like some physical challenges, right? So just as we age, there's, a natural decrease in our aerobic capacity, for example. And so even if you are super active starting in your 30s, you're going to see a decrease in aerobic capacity, even if you are really active. So then you are kind of fighting some, challenges like that as well. But let's talk strategies. So, you can find time to exercise if you feel that it's a priority, which hopefully I'll convince you during this presentation that it is. Some things we've already talked about: finding things you enjoy, finding activities the whole family can do, making your leisure time active time. These are all really great strategies to help you be more active. But there's other things you can do. So one, schedule your workouts on your calendar, just like you would any other meeting or appointment. That way you have that sacred time blocked off. You can prioritize it. Exercise is just as important as other things that you have going on in your day. And so making it a point to schedule it in, I think, always helps. The other thing is prioritizing exercise first thing in the morning. I'm promise you'll be happy that you did it, and you will feel better all day if you get exercise accomplished first thing. It's less likely to slip if you do it first thing. Otherwise it's inevitably you're going to get busy, and then you're going to be tired, and then something's going to happen. And so getting it done first thing in the day increases the likelihood that it will happen. The other thing is, if you don't have a 30 or 60-minute chunk of time, then break up your workouts into smaller chunks. It can be a lot more manageable that way. So as an example, wake up and before you hop in the shower, do 10 minutes of core work or body weight strength, like push-ups and squats. And then during your lunch, go for a 10 or 15-minute walk outside. And then finally, at the end of the day, maybe right before you have dinner or right after you have dinner, do another 10 or 15 minutes of body weight strength or yoga or stretching. And now all of a sudden you've exercised for 30 to 40 minutes, but you were able to fit it in smaller chunks, which often can be much more manageable for people. The other thing that I don't want you to undervalue is this concept of NEAT. It's non-exercise activity thermogenesis. So think about any activity you do during the day that doesn't fall into that quote unquote exercise bucket. So this is chores, walking up and down your stairs, carrying your kids around, how far you have to walk from your car into your office, things like that. And these things can really add up during the day. You take a couple extra trips up and down the stairs, or you decide to park further from the office, or you take your, stairs at work over the elevator. Just little things like that will really help kind of go a long way. And then finally, like some special considerations. So obviously everyone is different. There's certain cases where a fitness routine would need to be significantly modified if you had underlying health conditions, previous injuries, physical disabilities, etc. My advice is to always seek medical clearance before undertaking a new fitness routine, to make sure that you can handle kind of what you're going to start. The last thing you want to do is get injured, and that will sideline you from being able to be more active. So I'll pause quickly, just to see if anybody has any questions on anything we've covered so far. Think I see maybe a question. If you have a question, you feel free to unmute, or you can type it in the chat.
So Diana, is in terms of exercise versus the NEAT, is exercise, like intentional exercise, better than just being more active, like parking further away from where you have to go and like increasing the NEAT? And
Sure.
then can you talk a little bit about, you've talked to me before about like the concept of exercise snacks.
Yeah.
Which I think is kind of an interesting concept.
Yeah, for sure. So intentional exercise, there's different types of exercise and they have different values. So, cardio exercise, aerobic exercise helps with your, strength in your heart. You want to get your heart rate up because it makes your heart stronger. Strength training helps build more muscle. So there's, reasons behind intentional exercise that have benefits beyond just burning calories. From a NEAT perspective, we're really talking about just burning more calories throughout the day. So being more active, moving more, getting more steps is going to help you burn more calories, which will add up, especially if your goal is weight loss. But it won't necessarily check the boxes of, really making you stronger or building, much more muscle, because we want to be, using resistance training for that, or, getting our heart rate up. I mean, certainly if you are taking the stairs at work and you work on the 19th floor, I mean, that's going to get your heart rate up. So, there's benefits to both, but, the NEAT part of it is really just helping drive up more calorie burn throughout the day, whereas the intentional exercise has much like bigger health benefits, if that makes sense. And then the concept of these like exercise snacks, or, these little like chunks throughout the day. Maybe you have 30 seconds that you have between things that you can, do some push-ups or jumping jacks. It's the idea that, we have, especially if you have a desk job or if you have a profession where you're somewhat sedentary and you're just sitting all day, those long periods of being sedentary aren't good for us for a number of reasons. And so, even just getting up and walking around your office, or, taking a trip outside, walking around the building, like even if it's these little tiny exercise snacks or little mini breaks, it just helps kind of get you up, get you moving, get your blood pumping instead of just kind of sitting all the time. But I really do love the concept of breaking up workouts into smaller chunks if you don't have that time. So certainly if you are training for something very specific, if you're an endurance athlete, then yes, you need to be able to allocate that time to go out and go for long runs or long walks or bike rides or whatever it is. So that makes sense. But if you are looking to exercise for general health purposes, you will largely get the same benefits if you break your workouts up into smaller chunks than if you did it all at the same time. So don't feel like you're shortchanging yourself if, oh, I don't have 30 minutes or 60 minutes, all I have, but I can fit in 3 10 minutes. Great, fit in the 3 10 minutes. You're going to get largely the same benefits. Thanks for the question. Any other questions before we move on? Awesome. So our next kind of stage that I want to cover is pregnancy and postpartum, which is obviously a very like big milestone in a woman's life. It's really exciting, and it can be inspirational for women to want to exercise more and eat healthier, not only for them but also for their baby. And so largely the pregnant woman's physical activity recommendations are similar to just an adult woman's. It's to get at least 150 minutes of moderate intensity aerobic activity every week. Unless there are medical reasons not to, the American College of Obstetricians and Gynecologists recommends only minimal changes to exercise routines. And we're going to talk about what some of those modifications are. As long as you currently exercise. So if you already consistently exercise and you're having an uncomplicated pregnancy, it's likely you can continue your exercise routine with slight modifications. Now, if you haven't exercised in the past and were previously sedentary, then you certainly should consult with your physician and be cleared before starting an exercise program. And so it's obvious that pregnancy comes with some significant physiological changes that can prove, challenging and impact a woman's health. Some of the structural and hormonal changes that occur is there's an increase in some hormones, progesterone, estrogen, and relaxin. And so relaxin is what relaxes the connective tissue and ligaments and surrounding joints. It helps you to prepare for delivery, but it also can increase your risk for injuries, and because it makes your joints kind of hypermobile. And so that is one thing to be mindful of as, if you are pregnant or know someone who's pregnant, that they need to be mindful not to overstretch because they can injure themselves. Also, as pregnancy progresses, your anterior abdomen increases in size, which shifts your center of balance. And so it affects not only your balance, but your posture. So healthy weight gain is a concern during pregnancy. Weight gain is critical for development of the fetus and the mother's health. But excess weight gain has been linked to increased risk for things like gestational diabetes and even complications during delivery. The cardiovascular system adapts in several ways during pregnancy, including but not limited to an increase in your resting heart rate, your stroke volume, so again, the amount of blood pumped with each beat, and your cardiac output. And you also could see a possible slight decrease in your diastolic blood pressure. These changes occur regardless of training status. So even if you're super active or very sedentary, these changes are going to occur regardless. And the increase in your resting heart rate can appear early as 2 to 5 weeks into pregnancy. So one thing to keep in mind is that if you are pregnant or thinking about becoming pregnant, it would make sense to wear a heart rate monitor or monitor yourself by like your rate of perceived exertion through your workouts to make sure you're not overexerting yourself. During the pre and postnatal period, one of the main concerns is with the skeleton is decreased bone mineral content due to the fetus mobilizing and using maternal calcium for fetal skeletal development. So what's interesting is when you are pregnant, there's a big emphasis on nutrition, obviously, to make sure that you're getting everything that the baby needs. But often what will happen is the baby will get what it needs because it will, if it's not getting it through the mother's diet, it will just take it from the mother. So if you're not getting enough calcium, to support fetal bone development, then likely the fetus will start, taking the calcium from mom's bones, which can leave you at risk for, impaired bone density. This typically is temporary and shouldn't be a long-term issue, but all the more reason to make sure you're eating, appropriate, getting the vitamins and minerals you need during pregnancy. So there's a number of safe exercises you can do during pregnancy: walking, stationary cycling, aerobic exercises, resistance exercises, stretching, hydrotherapy, water aerobics are all really great. Flexibility and balance training can also be included, with special consideration, again, to avoid excess or overstretching due to that increased ligament laxity, as well as a risk of falling. So we want to make sure that we're not doing anything that's going to have a high risk of falling. It's important to stay really well hydrated to make sure that you're not overheating or becoming too breathless. So these are all things to be mindful of if you or someone you know of is pregnant. There are some specific modifications that make sense by trimester. So in the first trimester, it's important to avoid flexion-based core exercises. So things like sit-ups, because they can place a lot of pressure on the abdomen. In addition, flexibility training should be done with caution, to not overstretch those muscles. And you may experience more shortness of breath than usual. So aerobic exercises should be kept at a moderate intensity. As you progress along to the second trimester, engaging in resistance-based exercises can be helpful to counteract the effects of the growing uterus, which puts pressure on your core and your postural alignment. So simple modifications could be to decrease the range of motion of exercises, using a wider stance to increase your stability, or using, a nice, slow and controlled tempo. If appropriate, it may be beneficial to use cables or resistance bands instead of free weights to minimize the risk of trauma from weights falling. Another important consideration is to avoid laying prone or face down, or supine, face up, as the weight of the uterus can compress the blood vessels that return blood back to the heart, which can be problematic. Another thing is the size of the uterus will shift your center of gravity during the second trimester. So as a result, you want to avoid exercises that demand a high level of balance, and you can simply modify these by holding onto a chair or a wall when doing exercise. It's also important to note that, with the change of the center of gravity, there is more significant strain on your lower back muscles. In addition, as the uterus grows, it stretches on your abdomen muscles, making the muscle imbalance, more exacerbated. And so, unfortunately, over 60% of women suffer pregnancy-related back pain. So that's something to be mindful of. And lastly, the intensity of your cardiorespiratory training might need to be scaled back because you have decreased lung capacity due to your the growing uterus, and you will have a higher baseline resting heart rate. Third trimester, similar modifications are needed to accommodate your continually growing belly. Exercises should always be done in a comfortable and controlled fashion, range of motion that's well tolerated. It's really important to minimize that supine or prone position during the third trimester. And really some of the best activities are low impact variations as walking, stationary bikes, elliptical machines. But there are a number of benefits to exercise during pregnancy: improved cardiovascular fitness, rates of natural delivery, also decreases your risk for gestational diabetes, C-section risk, gestational hypertension, preeclampsia, preterm birth risk, and excessive weight gain. So a lot of really great benefits to exercise during pregnancy, both for baby and for mom. So now let's talk about post-baby. So the postpartum phase, and there are some very unique considerations here as well. So similar to pregnancy, postpartum women can gradually work her way back up to that 150 minutes of moderate intense exercise per week, starting with a nice, comfortable, and manageable workload. An easy way to think about it is dividing up that 150 minutes into 5 30-minute sessions per week, or it can be broken up even smaller, which might make sense, especially as you start back out initially into, say a 10-minute walk 3 times a day. While engaging in postpartum exercise, you should wear loose fitting clothing, well-fitted sports bra or nursing bra if needed, making sure you're staying really well hydrated, similar to during pregnancy, and trying to breastfeed or express milk prior to workouts is also helpful. Important to talk with your doctor, understand your medical clearance and recovery timelines. It is a really great time to start getting back into exercise. But a lot of studies show that it doesn't happen, right? That exercise tends to decrease after giving birth for various reasons. And so, depending on the mode of delivery, complications that arose during pregnancy, it may be necessary to kind of ease back in, and that's okay. And walking and pelvic floor exercises are like really a great place to start. So if you've had a healthy pregnancy and an uncomplicated vaginal delivery with no medical restrictions, you likely can begin doing some light walking and some, light pelvic floor exercises within a couple of days, once you feel ready. However, if you've had a C-section, you must allow for more time to recover, which is highly variable, but at least, 2 to 4 weeks to recover from the surgery. And that it may be possible to engage in walking as early as a week, as long as your doctor, clears you to do so. The good news is that all the cardiorespiratory changes that you've experienced during pregnancy quickly reverse within about 2 to 4 months after delivery, which is good. A lot of hormone changes happen. In the postpartum period, both estrogen and progesterone dramatically drop, which can possibly trigger postpartum depression. So certainly something to be mindful of if you yourself are pregnant or entering the postpartum phase, or you have a loved one who is, to be mindful of that, because this can also be exacerbated by lack of sleep and stress, which are usually both present when you have a newborn. And so, something to else be mindful of. Also, that lack of sleep and stress can inhibit an exercise routine as well. There are lots of benefits when it comes to exercise for postpartum, including strengthening back those abdominal muscles, increasing energy, improving sleep, helping with weight loss. Exercise can also decrease the risk of postpartum depression and help with levels of stress and postpartum recovery time. So it's interesting, right? Because we often don't exercise because we're low on sleep and we're stressed, but if we just exercised, it would help us sleep better and be less stressed. And so one thing that I wanted to cover is some of the issues that women can deal with in postpartum. So having some residual pelvic floor dysfunction, and some abdominal weakness. And so these are some things to be mindful of. They're things that can be worked through. And so, in addition to pelvic floor exercises, postpartum women should be encouraged to engage in core strengthening exercises. So studies have demonstrated that, gentle core exercises can decrease the risk of developing persistent diastasis recti, a condition that impacts up to about 60% of postpartum women. So diastasis recti, if you're not familiar with that term, occurs when your rectus abdominis, the muscles aligning the midline of your abdomen, are weakened due to carrying around, a growing baby. And so those muscles are located directly anterior to the uterus and consequently have stretched to accommodate carrying a baby. So one way you could check if you have diastasis recti is you lie flat on your back, your knees bent, feet flat on the floor, and you lift your upper back slightly off the ground to activate your abdominal muscles. Just think of doing a slight crunch. And then you can place your fingers around your belly button, and you have diastasis recti if you feel a gap in the midline between your core muscles, right around your belly button. Experts agree that if you could fit 2 fingers between those muscles, width-wise, that's considered abnormal. Thankfully, diastasis recti can heal on its own, but core training is usually the first line of treatment. And so, that's one thing that you can start working on in that postpartum time frame, is working on strengthening those core work muscles, bringing everything back together, really focusing on what's called your transverse abdominis muscles and your obliques. And one exercise you can do, and we can try it all together because you can do it sitting in a chair. And in all honesty, it's not just for women who are recovering from postpartum. I think this is a good exercise and technique for everyone to learn. So if you're sitting in your chair, you can put your feet flat on the floor. And we're going to do some diaphragmatic breathing. And so a lot of times when we breathe, we're called shallow breathers or chest breathers. We only breathe and our chest rises up and down. But here I want us to try to force air all the way down into your belly. So you can put a hand on your stomach, right around your belly button, so you can feel. And I want you to inhale through your nose, while focusing on expanding your abdomen laterally. So think about almost like inflating a beach ball in your belly. So you're going to inhale in through your nose. And then as you exhale through your mouth, I want you to focus on squeezing and drawing in your abdomen muscles. Think that if you were wearing a corset and someone was zipping you up. And as you fully exhale, at the peak of exhalation, you should be fully contracted. That's what's activating your transverse abdominis. And so you hold that for a second, and then you release and begin to inhale again and repeat. And this is a really good exercise for anyone to do, not only someone who's dealing with diastasis recti, but it really helps with strengthening your pelvic floor and strengthening your core muscles. Also, diaphragmatic breathing is good for helping to manage stress as well. So that's something that everyone can benefit from. The other thing is, the second challenge is pelvic floor dysfunction. So through pregnancy, as the uterus becomes heavier, the pelvic floor muscles stretch and they weaken. This is responsible, these muscles are responsible for bladder control, and supporting the pelvic muscles. It's responsible for if you've had children and then if you sneeze and some pee comes out, that's what this is. And so we can work to strengthen this and fix this as well by doing that diaphragmatic breathing, by engaging our pelvic floor, so that we can strengthen everything. And you've probably heard of Kegel exercises. This is another way that we can help kind of strengthen everything. And I think those are some things that everyone can kind of work on. Any questions on the pregnancy, postpartum phase before we jump into menopause, perimenopause? Where's where we're going to start. So I have a lot of clients that fall into this range. And it's a really interesting time period, and there's a lot going on. And so I want to spend some time here kind of talking through it. So, menopause isn't this single event, but rather a transition, and it could last many years. And for those of you that have gone through menopause, I'm sure you can acknowledge that it can last many years. So it's broken down into, 4 parts. We have premenopause, which is the time when menstruation is normal. Perimenopause, which is the time when menstruation becomes more infrequent and most symptoms occur. Then you have menopause, which is defined as the day of your final menstrual period. And then you are in postmenopause, which is defined as the time in a woman's life when your ovaries are no longer functioning and menstruation has ceased for at least 12 consecutive months. So that's the definition for being in postmenopause. Women are also considered postmenopausal if their ovaries were surgically removed or damaged during chemotherapy. Note that if you had a hysterectomy where only the uterus was removed, this doesn't affect your ovaries or menopause. So for most women, menopause typically occurs between the ages of 45 and 55. Premature menopause happens if it, before 40, and going through menopause between 40 and 45 is considered early. So the length and time that your body needs to do this transition is going to vary greatly among women. And there's several challenges that can arise. So let's talk a little bit about symptoms. Most women experience significant symptoms during menopause that can be classified into 4 broad categories. So the first is vasomotor, which are things like hot flashes and night sweats. And I feel like the ones that I hear a lot about. Physical, so body aches, musculoskeletal issues, fatigue, insomnia, and weight gain. Psychological, so anxiety, mood swings, depression, negative body image, brain fog, and then sexual, so things like loss of libido. And so there's a number of hormone changes, and I mentioned we were going to talk more about estrogen, and so that's where this really comes into play. And so these hormone changes that happen in your 40s and 50s significantly impact your health and can increase your risk for certain conditions. Some of these things are osteoporosis, cardiovascular disease, Alzheimer's, and other anxiety and weight-related issues. So estrogen is super important for women. So although it's typically thought of just a sex hormone, it actually plays a much broader role in our body by regulating body systems such as your endocrine system, your immune system, and your neurological system. It plays a significant role in bone, skeletal, and heart health, and many aspects of your mental health, such as anxiety and depression. It also helps regulate those feel-good hormones and neurotransmitters, such as dopamine, oxytocin, serotonin, and norepinephrine. So during perimenopause, estrogen levels begin to decrease a few years before your final period, and then will eventually stabilize about 2 years after your last menstrual period. Estrogen has a protective effect on your cardiovascular health. So, as with the decline of estrogen, has been linked to various vascular function and inflammation changes, increasing your risk of cardiovascular disease. In fact, the risk of cardiovascular disease is 44% higher in women than in men, while the stroke risk doubles during the 10 years after menopause. So these are pretty substantial statistics here that we're talking about due to this, decrease in hormones. It also is the decrease in estrogen has also been linked to changes in your respiratory health, showing a rapid decline in lung function. Another hormone worth noting is the FSH, or your follicle stimulating hormone. So what's interesting about this is the hormone that's used to control ovulation. It's also the one that they use to commonly test about your menopausal status. So according to the North American Menopause Society, levels greater than 25 international units per liter indicate that you are in the beginning of perimenopause, and consistent FSH blood levels of greater than 30 international units per milliliter, plus a last menstrual period being of more than 12 months ago, generally is accepted as a sign that you're in postmenopause. So this isn't like a total foolproof thing because hormones levels can fluctuate, but it is a possible indicator of menopause status. The other one I wanted to talk about is cortisol, which is really important. So if you're not familiar with what cortisol is often referred to as your fight or flight or your stress hormone. And it is the hormone that's released in response to challenging situations. So unlike other hormones that decline with age, cortisol levels are not impacted by age. Its purpose is to regulate the body's stress response, regulate blood pressure, blood sugar, control the utilization of fats, proteins, and carbohydrates. Very important. Our cortisol is naturally higher in the morning and then taper down as the day goes. But if you're in this constant state of stress or fight or flight, then your cortisol levels can remain high all the time, which is not ideal. So estrogen helps balance out the effects of cortisol. Unfortunately, during menopause, estrogen goes down, and so then the body is less equipped to cope with stress, therefore creating possible chronic cortisol elevations. And this can actually result in excess fat storage around the abdominal area. That visceral fat we talked about that raises your risk for cardiovascular issues can actually be increased due to raised cortisol levels. So if you've heard people say in the past that sometimes stress could be a reason why you're not able to lose weight, this is why, and it has to do with this regulation with cortisol and in hormones. So which is very interesting. So there's a number of impacts to your physiological symptoms and body composition. So as women's age and experience the changes of menopause, Bone density changes are a common concern. As I mentioned, you reach your peak bone mass in 30s, and then bone density starts to decrease. And so a low level of physical activity or an imbalance of hormones can certainly exacerbate this. Exercise has a positive effect on bone mineral density, which is really important. Another thing that changes is when women go from pre to postmenopausal is a decrease in their maximal heart rate, which continues as you age. And one way you can kind of stave off this decrease is by getting enough cardiovascular exercise and maintaining, your level of fitness. While your endocrine system is mainly stable during premenopausal years, it undergoes several changes during menopause, and it can take a very unpredictable path. And so if if you're struggling, if you're in this perimenopausal phase or menopausal phase, or you don't know and you're struggling, then it would be important to work with your physician to monitor your hormone levels, helps you to make decisions on how to best proceed to maximize your health during this period. 30 to 50% of women develop hypertension before the age of 60. And studies report that the frequency and the severity of menopause systems, especially things like those vasomotor symptoms, the hot flashes, the night sweats, and the sleep disturbances, are all linked to higher levels of cardiovascular disease. And so, being physically active is super important to help ward off some of these symptoms and some of these negative side effects. But unfortunately, only 7.2% of women going through menopause get the current recommended level of physical activity. The other thing is metabolism changes. And so, what's interesting here is that I have a lot of women that come to me and they say, I've always eaten the same. I haven't changed what I eat, but now all of a sudden I can't stop gaining weight. And so, all these changes are what's like impacting that. When we have, negative changes in body composition are a concern, because as we lose muscle, it's not only leaving us with less strength, but as I mentioned earlier, right, the amount of muscle directly impacts your resting metabolic rate. So how many calories you burn throughout the day. So as your metabolism is then slowing down, if you're not making changes, then you are going to see this increase in weight. Also, your bone density will decline at a faster rate, with the possibility of more, a broken bone from a fall. Maintaining muscle mass should be a priority for women going through menopause. If you know me, you know that I talk about strength training a lot and its value. And this is just another reason why it is important. Without gradually, with these gradual changes in our metabolism, if you're not going to change your average food intake, or we're not going to change your exercise, then unfortunately, you will see gradual weight gain. There are also other risk factors as well. So while the recommendations, are largely the same as adult women, you can see that exercise is so important during this phase. So, again, the recommendations may be the same, but I think the value and the importance of exercise actually goes up during this time to help, with maintaining muscle mass, with maintaining bone mineral density, with helping out with, stress management and body image and all of that. So I'm going to pause to see if there's any questions before we transition into our final stage, which is our postmenopause and beyond. All right. So postmenopause and beyond. Postmenopause, like I mentioned, is defined when you are at least 12 months past, menstruation. So you haven't had a period in 12 consecutive months. And due to the increase in our life expectancy, it is likely that women will spend up to 40% of their lives in postmenopause. So there's a lot of time kind of in this range, which is great. And the recommendations for women in this phase are largely the same as they are for adult women, except a few kind of additions. So there's, older adults should also include balance training, and this is really important, as well as the aerobic and the muscle strengthening. As we get older and our bone mineral density decreases, it's important that we work on our balance. We'll talk a little bit more about that. Older adults should also determine their level of intensity relative to their level of fitness. And if you have a chronic condition, you need to understand how that impacts, your ability to do regular activity safely. And so really it's just about knowing yourself and understanding what your limitations may be as you get older. And if you can't do the 150 minutes of moderate intensity activity, then be as physical active as you can up to that point. So the aging process affects all physiological symptoms and systems, including your neuromuscular system and its function of strength, muscle control, coordination of movement, and balance. So the degeneration of your neuromuscular system can lead to an increase in falls, unfortunately, which can result in injury. And even falls or the fear of falling can lead to a reduced quality of life, as older women are especially vulnerable to the loss of lean body mass from reduced physical activity, which often leads to reduced independence. And so it's really important that we want to work on balance training. Balance training programs have proven to be very effective in reducing the risk of falls, improving self-confidence, and really just improving quality of life as we get older. Some simple exercises you can do for balance are simply just standing on one foot. So shifting your balance, standing on one foot, starting with your eyes open. Then to challenge yourself, you can close your eyes, which makes it a little bit more challenging. Once you've kind of mastered that, you could work on shifting your balance by doing leg reaches. So lifting up one leg to the front, to the side, to the back, and then alternating, or trying to move your upper body. So maybe windmilling your arms while still standing on one foot. I do these types of activities, balance training activities with my clients in my gym every day. I think balance training is super important and something that we often neglect. It's also important to focus on like functional fitness. I know any clients that I work with that are in this stage of life, we focus a lot on functional mobility, functional fitness, being able to do kind of everyday movement patterns. The physiological impacts I wanted to really touch on are related to our bones and muscles. So osteopenia is a condition that begins when you lose bone mass as your bones get weaker. And osteopenia can be a precursor to osteoporosis. Osteoporosis is a bone disease that develops when bone mineral density and bone mass decreases. So this leads to a decrease in bone strength, which can increase the risk of fractures. One thing that you can do to help protect yourself against these, again, we're not really increasing our bone mineral density at this point, but we are working to slow down bone loss. Weight-bearing exercises and strength training are super important. But if you have osteoporosis, then it is important that you do limit high impact activities like jumping, running, jogging, bending, twisting, really anything that could increase your risk of falling. My suggestion is that if you're in this menopause or post-menopause phase, I suggest talking with your doctor about getting a DEXA scan done to assess your bone density. I think that's super important. It'd be good for you to know how you are if you're entering that osteopenia phase or past that, and then you could always adjust your routine or what you need to add in to help you. Now, sarcopenia is defined as the decrease in muscle mass that occurs starting around age 50. Sarcopenia tends to be more pronounced in women than in men, and the loss of muscle mass makes it more difficult to avoid gaining fat because, as we talked about, muscle contributes so much to your resting energy metabolism. And so the good news is that sarcopenia is largely preventable with appropriate nutrition and resistance training. So again, another plug for why strength training is so important. Next, we talk about weight management. So aging presents a variety of challenges to weight control, including a decrease in muscle mass, decreased activity, decreased protein consumption, decreased sleep patterns. And so resistance training and aerobic activity are super important for weight management as you age. It's been shown that your metabolic rate will stay relatively constant if you can maintain your muscle mass. And so again, incorporating exercise into your daily routine will help keep that metabolism up. And the last thing I wanted to note here is that getting older does not mean you have to give up athletics. Older athletes all over the world are breaking records and maintaining exceptional fitness in their 60s, 70s, 80s, and beyond. And each year in the National Senior Games, athletes over 50 compete in all sorts of activities from archery to triathlons. And I wanted to share a brief video of a woman called Julia Hurricane Hawkins, who started running at the young age of 101 and broke a record.
What should we tell our listeners and viewers about what we saw today?
Just stay healthy and keep running. And I'm going to keep running as long as I can. I find it fun. I like doing it.
I wanted to share this because I came across this video and I just loved it. The fact that she started running at 101, I think is amazing. Broke a record at 105. Is just really, really incredible. And so it's a good signal to you that it's never too late to start exercising, and that exercise is super important. So I just want to kind of close briefly with a quick summary. Hopefully everybody can see my slides again. If not, let me know. Exercise is important at every age. I think that's what we've learned coming out of this, from, as little as we can, encourage kids to be active all the way up through post-menopause, up to age 105. Exercise is important at every age. It is never too late to start. And, focusing on variety. Variety is key. Having a well-rounded fitness routine will not only keep it fun, but you're less likely to get bored. It gives you the physical benefits that you're looking for. Focus on the fun, get the whole family involved, make it a girls' outing, involve your spouse, whatever it is. Making it fun will definitely keep you motivated. As we learned tonight, each stage comes with its own challenges and considerations, but also a lot of opportunity to try new things. And then finally, know that you don't have to do this on your own. Certainly you can reach out if you're struggling or you don't really know where to begin. I'd love to coach you on your fitness journey. I have my contact information here. My email is diana@bewell-healthcoach.com. And I also have a website, bewell.healthcoach.com. I have a number of resources here based on, information I pulled to make this presentation, but just, the physical activity guidelines for Americans is a good resource. Move Your Way is focused on getting kids active. There are some great resources from the American College of Obstetricians and Gynecologists if you're pregnancy or postpartum, and then a number of resources related to menopause, as well as I included my YouTube page, which has got some workouts. I'll be posting this training or this webinar on that page as well. So I just want to pause and say thank you so much for joining me tonight. I hope you found this interesting and informative. And I hope that if nothing else, you're leaving with extra motivation to exercise and the understanding of how really valuable it is to your overall well-being. So with that, I close. I'm happy to answer any questions that you have. I am going to wrap up the recording part of tonight's presentation. And then if anyone wants to stick around and ask questions after that, I'm happy to hang on. So I'm going to stop the recording.